More than 10% of Americans suffer from chronic pain. Pain can affect anyone, and depending on the severity, it can become life altering. There are many different treatment options to manage pain, and normally, once all of those options have been exhausted and the provider sees necessary, then opioids are used. So, prescription opioids like oxycodone are a very powerful pharmacological method in pain management. And when used to treat chronic pain, they're taken for an extended period of time, and that can, lead to a tolerance or dependency to develop, which puts the patient at risk for maybe addiction or maybe even overdose. And there's also data that correlates extended opioid use with subsequent depression. So last year, there were 58 opioid prescriptions written for every 100 Americans, and with an average of 3.4 prescriptions per client. So that's a lot. Currently, providers can utilize guidelines that were published by the Center for Disease Control regarding prescribing opioids for chronic pain, but I'm proposing that this becomes a more concrete process. This policy will be implemented to assure that clients' pain is being treated effectively and also safely. So when prescribing an opioid to manage chronic pain not related to a terminal illness, the provider will obviously explain all the risks that come with taking an opioid long term, as well as explaining all of the requirements, I guess you could say, as part of having a opioid prescription for chronic pain. And so these mandatory conditions will include an initial consult with a psychotherapist to assure that weekly visits aren't necessary, and also an initial consult with any other adjunctive therapist that the provider and client feel could be helpful. And there will also be random drug testing, which I know seems intrusive, but this is just to assure that the client isn't misusing their prescription or any other substances. It's just all about safety. So quarterly follow-up visits will be scheduled for the client to check in with the provider and just make sure that their pain is being managed, obviously effectively, but also that they're not at any risk for any of those negative outcomes from taking an opioid long term. So this policy was created on the premise that this affects a lot of people, and the risks of treatment should never outweigh the benefits.